Hello, my name is Dr. Komilesi Saturday. We don't come back again with our Obonge series, which is the Medicine for Pidgin English. Medicine for Pidgin English. You hear them well. Now, this is our own wonderful series where they break down the real medical conditions, a lot of the medical conditions, they break them down using Pidgin English. This approach, they're very important, particularly for doctors, nurses, pharmacists, medical students, and of course, medical enthusiasts, people will like to know how some medical conditions start and how if you move from one person to the other. So this particular video, they're important for you and for everybody in order for you to understand how some conditions they happen and how you feel for prevent yourself from getting it. Okay, so today particularly, we're going to talk about one very important topic for medicine, particularly for people from our area. I know say you don't hear this one before. For example, you go don't hear that thing where they go tell you say, come out that pikin under that fan, come out under that AC, because it's too much cold, enter that pikin, you go get what? Pneumonia. Correct, you get them. So most of the times you go don't hear that and say, I beg no go under rain, no stay under rain too much, no allow cold catch you too much, because you will get pneumonia. Yes. So for this our Obonge lecture today and this our discussion and interaction, we go want to know, okay, you go know the answer and we go share the answer together, whether cold they cause pneumonia. Okay, so they're very, very important. Make you listen to this lecture. Okay, I will repeat them again. Today for the lecture, we go want to know and we go know whether cold they cause pneumonia. So that time when they tell you say make you know they under AC for long time, make you know they under fan, or make you know they under rain for long time, say you go get pneumonia. Whether actually not true or no be true, we go discuss them today. So as we do before, we get very systematic approach where we actually discuss any topic where we discuss. So today we go start from introduction. We enter definition. We will talk about what be the predisposing factors. When we talk about predisposing factor, we talk about risk factors. Okay. We also talk about what be the etiology. Etiology now what they call the cause. What actually cause the disease. Now that one they call etiology. We will also talk about clinical features. Clinical features now the things where you go see, okay, for the person. Okay, we get the condition. Then you go actually they know say okay. Maybe this person don't catch that condition. Maybe this person get that thing or not. We go also talk about what be the morphology. Okay, so when you they look at the structure of that particular organ where they involve, waiting be the actual morphology of that organ, waiting how you go carry see the organ if the person actually get that condition. This one, medical doctors and medical personnel will know that one. Stages of lobar pneumonia. We will also discuss what be the stages of this particular lobar pneumonia. Lobar pneumonia now another part of the Obonge topic today we will discuss. So we will understand what be the stages, okay, and what be the characteristics. Not characteristics, what be the characteristics of each of the stages. The next one we will talk about the laboratory diagnosis. So we will like understand, okay, waiting they important to use for lab diagnosis for that particular condition where they call pneumonia. Okay, we will try to understand waiting you guys do. So if you know say person get pneumonia and the person they go hospital, waiting you guys expect say the doctor go check and go do to ensure say then confirm say the person get pneumonia. Okay, we go also check waiting be the treatment. This one they very important because for where we come from, a lot of people they do self-treatment. We're no good. Okay, so we would like to tell you waiting be the treatment and why they're also important. Make you allow doctor and medical personnel where sabi the thing well to actually treat you when you get even the smallest condition, and particularly this important one of these important condition where they call pneumonia. God no go gree on a get am, no worry. And the next one, how you fit prevent am. How you go carry prevent am. So if you know say one of your friend get pneumonia, or somebody where you know get pneumonia, or you hear am around, so how you fit prevent your own self from getting that pneumonia. That na one thing we also talk about today. So you see the reason why you no need come on here, shey? All right, we go talk about wetin be the complications. Complication for na very big English word, okay? For some people, you know, go big. Those people go Queen's College. I dey joke, Jerry. So complications now, the things wey actually go happen if you no for take time treat the thing, if you no treat the condition on time, the things wey go make am dey very big, okay? The out result, okay? The extension. This Pidgin hard. When they talk about wetin go happen if you no treat am on time and you treat am late, wetin go happen, or if you no treat am at all. Now that one that they call complication. And then we will discuss some questions together. And one particular question wey me I dey throw to una now before we go start the main session, I be say if you dey under fan or AC or rain, because now wetin we don dey argue since. A lot of people don't talk about these things when they grow up, and even when we dey medical school. If you dey under rain or under fan, you go get pneumonia. The rain or cold, they cause the pneumonia, or wetin be the thing where they cause pneumonia when you dey under rain or when cold catch you. So no wahala, my people, I want make una dey around. Okay, we go discuss this topic in the next slide. But I want to tell una this thing. This session dey very important. Okay, this one na one of the ways we actually want help medical practitioners, medical students, medical enthusiasts, for people, make them for understand, medicine in Pidgin English. Because when they explain something to you for language where you dey very familiar with, it dey actually dey help. Okay, it will help you for understand them to detail. Now make we bring up this thing because the rate of mortality where they our place too much. I know say we don't dey vex. People they die every day because of very simple things where we say they for fit for prevent them. But when they do advert for TV, most of the advert go be for English. And our people where they for village no go fit understand wetin this thing actually they mean. For example, see this coronavirus situation now. Most people for village no understand them, except we get people where they on the field for there, we sabi speak their local language. So this one are one of the steps we they take to ensure say our medical practitioners, medical students, they for fit understand some medical concept for their local language. So when you meet patients when no fit speak English well, you feel relate to them the condition on a very, on the same level with them. You feel explain to them on the same level, and you feel even go into even deeper details to make them understand everything about the condition, so that it go for prevent what thing go happen next. Because for this part of the world where we dey, you go see person wey no dey medicine at all, wey no study medicine, but you understand a lot of things about the human body and about the human system, how it dey for function. And you go to marvel, but you no study medicine now, you don't know anything about. So how? But the point be say the medicine itself dey for the English language, and English language na their language. Shey you forget them now. And then when they go hospital, doctor go easily explain everything to them, and they go digest them well because now for their language. I know say Pidgin no be our own native language, but now one of the easiest languages where they use to communicate for where we come from. So if everybody generally understand one or two bit of Pidgin, it is much more easier for us to relate that concept, that idea, to the people, make them for understand them well. So that is the reason why we start this series. And we don't start them before, we don't do anatomy in Pidgin, and this one a continuation. We're going to discuss medical series, medical topics. So if you tell us which one you want make we discuss next, we're going to discuss them. But for right now, we go into pneumonia. So stay put, no go anywhere. Make sure say you listen to the lecture till the end, and make you for understand what pneumonia actually mean, and to see whether you dey at risk of getting pneumonia. God no go agree, but make you for check. Okay? It's teaching time. They talk and say it's Steve 9. See you in the next slide.